Now we're going to talk about the granddaddy of deadlifts, and this is the kind of deadlift that when people talk about deadlifts, this is most commonly what they're referring to as using the straight bar to deadlift. It's a good exercise, nothing wrong with it, but if you're having low back pain and back issues, then this is probably not the best option for you. There's other technique demands that are different than both the kettlebell deadlift and the trap bar deadlift. And I know some bros out there, this is basically the only way to deadlift. And like, hey, that's cool, man. If you want to jack up your low back, be my guest. But if you're doing it and you're noticing that you're having chronic issues with it, make the change. It's only going to help you, not hurt you. And you can still lift a lot of weight with a trap bar. You can still do those things and not be in pain, which to me sounds like a pretty good deal. So with the straight bar, a couple different things that we have to consider and look at that are different than both the kettlebell and the trap bar. And the first thing is obviously the bar is straight, right? But with that, you cannot squat the weight up here, okay? With the trap bar, because of its shape, if your knees go forward a little bit, no big deal. Your knees go forward on this thing, one of two things happens. Either the bar drags up and smashes your shins on the way up, which hurts, and is also not the right way to do it. That's not some kind of weird badge of honor. It means you messed up, basically. So that's not good. The other thing that happens that if I'm trying to lift this bar and my knees get in the way, well, now I gotta move the bar around my knees to lift up. Remember back in the kettlebell video, I talked about decreasing the horizontal distance between me and the weight. Well, if I come up here and I gotta move this thing out, I'm increasing that horizontal distance, usually with a lot of weight on the bar too. So that is not great for the back. As the weight moves away from the knees, it tends to pull your weight off your heels, which will also tend to round your back. No good. None of that is any good. So that's where a lot of people jack up their deadlift, is that their knees come forward and then they have to move the bar around that. So that's the thing. Basically, your knees from here, and I'll show you in a second with the bar, but when I lift, my knees should kind of come back out of the way, right? So the path of the bar is vertical, straight up and down. It shouldn't be doing any kind of funny business. It's vertical, it's up and down, that's it. So that makes this version a little bit more challenging because you really have to have a good hip hinge. You really have to have a good understanding about how to do that. So what you want is when you set up here, right? So the first part of my motion is going to be driving back this way, not pushing forward, right? If you're chronically bashing your shin against the bar, not okay. You're doing it wrong. Fix that. Otherwise, you're always going to have problems. Or maybe just try a different version. Or maybe you need to really go back to the basics and improve your hip hinge and improve those other things. But what you should be able to do is you grab the bar up, and then heels and hips on the way down. Same idea, when you get to the bottom, pause, but keep everything tight, and then lift. Try not to bounce. And with deadlifts, something to consider is one less, not one more for reps, okay? So deadlifts are challenging. It's a total body exercise, pretty much works the entire back of your body from the shoulders right down to your feet. Okay, so there's a lot going on there. As you progress through, as you're getting towards the end of your set where you feel like you did a certain rep and you got up there and you struggled but you got it, that's probably a good place to stop. Especially if you're working on rehabbing an injury, don't do that one more where you're going to gear up. Because here's the thing, say you've done 6 solid reps and I'm going to get one more. Well, that 7th rep is not going to be better than the 6th one. It's going to look worse. It's going to be uglier than the 6th one. Do yourself a favor, because that one rep is not going to vault you that much further ahead, but you're opening yourself up to injuring the back or tweaking something else, and it will knock you backwards for sure if you get careless. So with deadlifts, I usually encourage people to do one less, not one more, especially when you're coming back from pain. Now, how do you modify the deadlift? So you can do a very similar thing. You can put it up on some boxes or step. You can also do a rack pull. So check out this video here. Basically, you set up on a squat rack. In my video, to get the appropriate height, I put it on the safety bars, but then I actually stand on a 4-inch step. That to me, for my setup here, it gets me in the right position for where I want to be. Depending on where you're doing it, you may be able to pull from the floor and have the bars on the rack, and that'll be fine. But make sure you adjust accordingly so you have the proper setup for you. One other consideration when you're working with the straight bar, and if you're dealing with any kind of low back issue, is that oftentimes when people lift with a straight bar, they use kind of a mixed grip where one palm is facing back, one palm is facing forward. This grip, without question, does allow you to hold on to much heavier weight than if you have both hands kind of overhand this way. So there's nothing wrong with that, but something to consider so we have what's called a carrying angle of the elbow. And sometimes when you get set up this way, this can kind of almost push the knee a little bit in. And that's gonna create issues up the leg into the hip, and the hip and the low back are linked. When one moves, the other moves. So something just to be mindful of, that as you're setting up, be mindful that if that elbow is pushing right against your knee, when you go to lift, you could actually be creating a little bit of a problem that is not going to help you as far as lifting more weight. It's going to put a ton of stress on both the knee, the low back, and it's going to make it tough, and harder to kind of get into the hips and use the glutes. So something just to keep in mind if you like the mixed grip, and if you are going heavier, as you're kind of warming up and going through some lighter sets, it may be worth switching your grip periodically, set by set, to kind of work both sides. But watch that elbow kind of pushing the knee in a little bit, because it might be something, it's subtle, and it might be happening, you may not be aware of it, but it's something that you should pay attention to as you're getting yourself set up. And if you're noticing that you can't really control that, that might be an indicator to kind of switch over and work with the trap bar a little bit more and see if you notice an improvement.